You know the scene, right? You're sitting in a chair, sleeve rolled up, and a phlebotomist is getting ready to draw some blood. It seems so routine, so simple. But what if I told you the most important part of that whole procedure has absolutely nothing to do with the needle? Let's get into the hidden science of what makes a perfect blood draw.
I mean, on the surface, it's just a needle in a tube. But the single biggest risk here isn't a shaky hand or a missed vein. It's drawing blood from the wrong person. Think about it. A simple mix-up could lead to a totally wrong diagnosis, incorrect treatment, and really serious harm. The true skill of a phlebotomist starts way before that needle ever comes near your skin. It's all about making sure you are you. So if it's not just about finding a vein, what exactly is a phlebotomist trained to do? Well, you might actually be surprised to hear that the physical act of drawing blood, that's just a small piece of a much, much bigger puzzle. A puzzle that's designed from the ground up to keep you safe.
Just take a look at what it takes to get certified. The official exam tells you everything you need to know. The actual collection of blood part, that's less than a third of the test. The huge majority, over 70%, is all about patient ID, infection control, and following the right procedures. It's really a science of safety.
So thinking of a blood draw as just a poke is kind of like saying a cross-country flight is just a takeoff. The poke itself is the final step, but getting there involves this whole complex safety protocol that has you, the patient, right at the very center of it all.
And that whole process, it kicks off the very first moment a phlebotomist walks into the room. Those initial things they do, they aren't just about being friendly. They're following a critical checklist to build trust and, more importantly, to make absolutely sure they have the right person. And don't just take my word for it. A quote straight from a phlebotomy training guide couldn't be any clearer. It says, the first and most important step is to properly identify the patient. That's job number one, period, before any equipment is even touched. And this isn't just casual chit-chat. It's a full-on verification process. A pro will always introduce themselves, but then, and this is key, they'll ask you to state your full name and date of birth. They won't read it to you and have you nod. That active confirmation is then checked against their forms, and only then, after you agree to it, can things move forward. And that final step where you give them the go-ahead, that actually has a name: informed consent. This is your fundamental right as a patient. You have to understand what's about to happen and why, and you have to agree to it. If you don't give your permission, the whole thing stops. It's a key protection for you.
Now, beyond those formal checks, a few simple questions are really empathy in action. They aren't just making small talk. When they ask if you fainted before or which arm you prefer or if you're on blood thinners, that's all part of a safety assessment. It's all about making the procedure as safe and as comfortable for you as they possibly can.
Okay, so your identity is confirmed. The next layer of safety immediately kicks in. And it's all about creating this invisible shield to protect both you and them from any kind of infection.
It's based on this idea called the chain of infection. The easiest way to picture it is like a series of dominoes. For an illness to spread, it needs all 6 of these links connected in a row. A phlebotomist's job is to find a way to knock over one of those dominoes before the chain reaction can even get started.
So that means every single safety step they take, from washing their hands to putting on new gloves, it's all designed with one purpose: find a link in that chain and break it. Stop the spread of infection before it has a chance to begin. And here are 2 of the most powerful ways to do that. First up, proper hand hygiene. We're talking at least 20 seconds of serious scrubbing. And second, personal protective equipment, or PPE. This always means a fresh pair of gloves for every single patient, and sometimes it can include other gear like masks or gowns if the situation calls for it. And there are actually 2 different levels of protection here. Standard precautions are the baseline. That means they treat all body fluids as potentially infectious, all the time, for everyone. But for patients who are known to have a contagious disease, they'll upgrade to what's called transmission-based precautions, adding extra layers like special masks or gowns just to make sure that chain of infection gets broken decisively. All right, so the patient is identified, the environment is safe. Now we finally get to the moment of collection. This is where that technical precision becomes absolutely critical. If this part goes wrong, the whole test could be useless. So much can go wrong right here. If multiple tubes are needed, they have to be filled in a very specific order because the additives in one tube can actually contaminate the next one. Leaving a tourniquet on for more than a minute, that can actually change your test results. A poor technique can literally burst blood cells, making the sample no good.
Even just forgetting to gently mix a tube afterward can ruin the whole thing. It is a highly technical skill.
So the needle is safely out, you've got a little bandage on your arm, and it feels like the job is done, right? Well, from a safety point of view, the work is only halfway through. Now the phlebotomist has to deal with all the contaminated materials.
And this final safety step is all about proper disposal. The needle goes immediately into a puncture-proof sharps container. It is never recapped. And then anything else that's contaminated, like the gauze or the gloves, goes into a separate, clearly marked biohazard container. This careful separation is a super important final step to protect everybody.
So, we have really unpacked all the science and safety that goes on behind the scenes. Now for what I think is the most important part. What does all this mean for you? How can this knowledge actually empower you when you're the patient? Because this knowledge really is empowering. You now know what a high-quality, professional, safe procedure is supposed to look like. So what should you expect? And frankly, what are your rights every single time someone comes to draw your blood? Let's just boil it down. Here's the key takeaway. You have the right to be asked for your name and your date of birth. You have the right for someone to explain what they're doing. You absolutely have the right to say no or stop at any point. And you have the right to privacy. You are an active participant in your own safety. So I'll leave you with this one question. The next time you roll up your sleeve, what will you notice that maybe you never did before? Will you see that careful identity check, the fresh gloves, the precise order of the tubes, not just as routine steps, but as this complex safety dance that's being performed just for you?